All right, today I have a client with adhesive capsulitis, also known as frozen shoulders. And what is that? That is essentially when your shoulder, the capsule within your shoulder joint, they become inflamed. And when they become inflamed, you're unable to move your shoulder, hence frozen, right? You're not able to get that proper mobility and you're restricted in certain capsular patterns, right? And that is flexion, abduction, external rotation, and internal rotation. And this is usually with individuals that have diabetes, because diabetes is one of the biggest indicator when professionals or physical therapists or any other medical provider is diagnosing a patient with adhesive capsulitis, also known as frozen shoulder. Also, their age. As you age and you get older, you tend to not move your shoulder as much, or you tend to be more immobilized. That is a great indicator because movement is medicine. If you don't move it, you lose it. So when you don't move your shoulder, you predispose yourself to having adhesive capsulitis as you get older. Also through traumatic injury, that can also cause adhesive capsulitis, also known as frozen shoulder. How do we treat this? First, we need to understand that there are 4 stages to frozen shoulder. There's a pre-freeze stage, there's a freezing stage, there's a frozen stage, and there's a thawing stage. The pre-freezing stage is the early onset, where the patient might notice that there's something wrong with their shoulder and they don't know what it may be if it's not a traumatic injury. The freezing stage now is when we start to see pain, right? They might have the mobility, but they start having pain with certain movements, whether that's reaching over their shoulders, doing their hair, anything that requires mobility of their shoulder. The third stage is the frozen stage, and that is when the pain might have subsided, but they're completely limited with motion. They can barely move their arm in any direction. That's when it's really, really frozen. And the last stage, about a year or so later, it comes to the thawing stage, and that's when it comes and you're able to gain back your mobility, and the pain also is subsided once again. So these are the 4 stages. So in order for me as a clinician to treat a patient, I need to understand what stage they are on, because certain stage requires certain intervention. And we have to focus on gentle mobility. We got to keep the shoulders mobilized, because mobility is what's gonna help this individual from a day-to-day aspect. Also, activity modifications. These are things that are essential.